Hi, I'm Dr. Polly Parsons. I'm the chair of medicine here at the University of Vermont. I probably have one of the best jobs in the world in that I get to work every day with world-class faculty and unbelievable medical residents and students. We run a department that prides itself in being able to deliver high-quality clinical care, and also we have exceptional research, but our major focus is on education. The residency program is clearly the center of our universe. We focus on it every day. All of our faculty are devoted to teaching and to training the next generation. We have faculty that are internationally known for their contributions to research and education. They, in aggregate, publish more than 300 articles per year in high-class journals, including the New England Journal, Science, Nature. They are the representatives at the National Institutes of Health, the FDA. They're frequently asked to be visiting professors throughout the world, and yet, on a day-to-day basis, we work together collaboratively. We're focused on the teaching mission.
Philosophically, around the program, I always come back to the word curiosity, and it really drives why I'm interested in being a program director, why I want to work at a big tertiary academic medical center. And by curiosity, it includes things like, how do I get smarter today? How do I take better care of patients? How do I figure out how a patient navigates this system better? How does the system get better? How does education improve? The questions just keep coming.
I love being part of the faculty here. My favorite part is working with the interns, residents, and fellows. I love to teach them. I love to mentor them. It's been a great relationship for the whole 20 years that I've been here.
I learn something literally every day that I didn't know. And it's great because you're busy and you work really hard, but at the same time, the environment is conducive to learning.
The best part about practicing in an academic setting, especially here at the University of Vermont Medical Center, is working with physicians of all levels, from medical students to residents to fellows. This is particularly true in the ICU, where we have a tight team that becomes more like family over the course of a month-long rotation.
I found people that I can identify with. The teaching is excellent here, the program is excellent. We have a lot of big names, and you never would know that because you run into these people in the hallway and talk to them about their kids or what they did this weekend.
I was actually a medical student at the University of Vermont. When I was interviewing, one of the key things that really stood out about the University of Vermont is how plugged in we were to the internal medicine program as students.
An exciting part of clinic is that we went to a 4+1 system. This has really allowed our residents to be dedicated to the clinic during the week they're here. They have less of a pull between inpatient and outpatient duties. And we have much more dedicated time for education sessions.
The community here is just supportive and intelligent, and a place where I felt that I could continue to learn medicine very well, but also develop as a person. I spoke to about 10 or 15 different potential mentors before I settled on my mentor, and that was an incredibly positive experience. And then even after that, I was able to not only present my research here at the University of Vermont, but I had multiple opportunities to present at national meetings, the American Heart Association meetings, and then even traveled abroad to as far as Japan, so that there were a lot of opportunities, not only here in the community, but our faculty and mentors understand how to get us represented nationwide and even globally.
Our residency director and our associate directors, their open door policy, always willing to respond to emails no matter how late they are at night, any concerns that we have, and always trying to make the program better.
I really like the hospital a lot because it's a large medical center. We have a lot of research. We're a tertiary care center, so we have a lot of referrals from outside areas, but we don't have to live in a big city to get that medical exposure, so it was a good combination of those two things for me.
I think it goes without saying that the hospital has a great reputation in terms of clinical trainees, and the types of physicians that they produce do well all over the country. When I came to interview here, everybody I met was happy and kind. They had a quiet confidence about them in terms of their medical knowledge and their expertise, but it seemed like everybody was really happy to be here and happy to work here. There's definitely a wide range of styles and different techniques with patients that I'm learning from. With regard to the program leadership, when I interviewed, I was really excited to see that the program leadership really embodied very strong passion for resident education, that it's obviously a huge focus of the institution here. We're not just the workforce of the hospital, our education is their priority, and I really like the balance between our formal education and structured learning time, and then just also time with our preceptors, clinical educators.
When you come, you will see the breadth and depth of internal medicine and all that it has to offer. You'll be exposed to the entire range of educational opportunities, research opportunities, and patient care opportunities so that you can really choose which career you want and then be extraordinarily successful in that career.
The residents here can look forward to having a great time during their 3 years of training. They can look forward to gaining the highest level of expertise in internal medicine. They can look forward to getting a great job when they finish here, whether it's talking about moving on to a fellowship program afterwards, becoming a hospitalist or a primary care physician. The future is extremely bright for all of our residents here.
Burlington is just an amazing community. Lots of activities there. It has a small town feel, but still a lot of the activities and entertainment that a little bit larger city has.
My co-interns are amazing. They are all super smart, super kind, trained in various things.
I feel like I found my place. I feel like these are my people. I think it's important to find your friends.
And one of the big draws of this program that made me want to stay is the relationships I'd built with the people here. It's those relationships that make for an environment which is welcoming, it's collegial, it's somewhere where you want to be.
Once you come here, you realize how amazing it is. It's kind of like our little secret is what a great program it is here, and you wouldn't know that until you came. So definitely check it out.